My interest in emergency medicine has always been the interplay between the social factors, such as poverty or homelessness, that affect patients' care. I wanted to find a way to be able to affect change on these social determinants of health. And I learned that probably the only way to do that was to actually engage the community. We do exactly what street medicine sounds like. We go out onto the street and provide care in homeless encampments, basically making house calls to the homeless, meeting patients where they are, obviously going in multidisciplinary teams, because the biggest thing affecting the healthcare of this population isn't bacteria or viruses, but the fact that they're homeless. And so we go out with our social workers, with our public health department, as well as our providers, to provide whole patient care to the homeless population in Tulare County. So when we started going out, we knew we were going to require some sort of funding for the medical supplies that we were providing. Luckily, Vituity, the medical partnership that I belong to, had something called an innovation grant. The innovation grant team provided me with the support and funding, but it also pushed me to expand the dream that I had of providing care for vulnerable populations here in Tulare County to places that I hadn't even thought of. For Vituity to set aside funds, set aside staff, and devote time to these type of initiatives, it means a lot to me. It means that it's more than just the bottom line for this organization, and it truly is about providing the best quality patient care that we can. It's about empowering physicians and their staff to come up with innovative ideas, and that everyone is seen as equal, whether I was a CEO or a pit doc, that my opinion mattered. It truly has allowed me to provide innovative care and realistic care to the homeless population here in Tulare County. Probably the most important outcome from our street medicine program has been the trust that we've gained from the homeless community. This is a community that, again, has suffered many indignities and has a lack of trust in the healthcare system. To be able to meet the patients where they are, to truly be able to listen to them and rehumanize them and have them realize that the healthcare system is reaching out to them, I think has made a huge difference, impact in my ability to make a patient-doctor relationship with them that starts on the street and that carries over to the emergency departments. And I think for a lot of the providers that go out with us, that's probably the greatest gift too, is being able to remember that you went into medicine to help people and being able to actually carry that out.